Hi, okay. So this is our instructor short essay feedback for our client, Taru. Now, one of the things that's unique about Taru from pretty much most of the virtual case studies that we're doing is that she has a chronic medical physiological condition that, at least in my opinion, is definitely part of um, our mental health picture here, or our DSM picture. So, so in this case, what I would do is I would have what I believe to be the primary DSM condition, and I would have that first, and then I would have the COPD in this case. Now, I believe that Drew says that to the EMS folks, if I remember correctly from the video. So I think she reports that. You wouldn't, certainly for our exercises here in general, and certainly for starting out, with postgraduate and on your doing being licensed and doing supervised clinical work. I don't want you to stress about, like, oh, if she didn't tell me she had COPD, like, how am I going to assess for that? You wouldn't. You could certainly ask. You would ask Drew if she has any other medical, physical, physiological health history that she thinks is worth mentioning to you, and you know, I think likely, just given, again, if we're assuming, and given what we know about Drew, again, as a fictional client, that she would likely tell you that she has COPD. And so assessing that her anxiety symptoms and her COPD are probably connected, that's how you would put that there. Now, for our exercises here, if you just put the DSM diagnosis and didn't have this diagnosis here, it wouldn't be wrong. Um, if she mentioned a specific condition that might seem pertinent, you want to make sure you have that in your, at least in your assessment part of the right. No, sorry, in your intervention planning, in terms of finding out more about that, asking more about that, asking if there's, if there's an opportunity to view other records from, like, primary care physician, or speak to a client, permission to speak to her, like her primary care provider, if that's possible. A lot of times it isn't. So just a word about that. But for our purposes here, in terms of me giving you feedback for the short essay quiz, so what I did was I did the DSM diagnosis that I believe was best fit in terms of criteria and presentation, and then I put the COPD, one, because she mentions it, and two, it's clearly, to me, connected to what's happening here. So what I did, and let me flip over here to give you an additional visual rather, right? So um, for panic disorder, reoccurrent unexpected panic attacks as identified here. So what I did was, going back here, criteria A is met based on observation, because we can observe her symptom, we can observe her as symptomatic in the video, and her own report, right? And so these are things that I noted that she reported to Rue in the video, as she's interacting with first the EMT and then in the hospital, um, and oops, sorry, and then have pull that from here, and so you see how that is written out, right? So we have, and I believe, the going back here, we want four or more. And so that's, made sure that there was four. If there were not four, might still give this diagnosis, but I would definitely make a note that it's provisional because the criteria is not fully met. And then the what happens post-attack, persistent worry, maladaptive behaviors. I think we need more clinical history, and so why that's important here, in addition to, is the criteria fully met or not? In this case, actually wouldn't be fully met, so we would call it provisional diagnosis. But this is also important to your intervention planning. So sometimes the criteria, going back here, sorry for flipping back and forth, I just want to make sure you have the visual. is these are things like this criteria B here. Okay, well, that's a good thing to drop into our therapy topics, part of our intervention planning. What do I want to ask Taru about? Okay, and then the others, no indication of problematic substance abuse with Taru, and no indication of another significant, at least in a significant way, DSM condition. Although I think the traumatic event of having the woman in the room next to her code and pass is probably a big piece of why we're here in this moment in terms of her current presentation in the video. Okay, so and I think those instructor notes here I've already covered. Here's the full write-up. If you want to take a look at that to give you sort of, I think why that's helpful as we get into more in depth into these case studies is throughout the course is then that'll give you, hey, here's not just the answer to the question on the quiz, but here it is in context with the rest of with my full write-up, and then it also gives you a sense of well, okay, what does a full write-up look like um, as we move towards the midterm practice case study write-up, and then of course you're going to do a couple case study write-ups for your comprehensive final. Okay, so that is the feedback for the short essay quiz on Taru.